Look at why more women are choosing to wait before having children.
Research from the CDC shows women are delaying childbirth into their 30s or even older. News 4's Christy Kern found out it could mean more resources, but also more health risks. Christy?
Don, Jackie, according to the CDC, the number of women having their first child after 35 continues to rise. Doctors in Western New York say they're also noticing the trend, but they also say there are some things you should know if you're planning to wait.
Older and older, and women and even in their mid-40s have delayed childbearing.
It's a different story from the past when women had babies in their early to mid-20s. Now, according to the CDC, the number of older women having their first child continues to rise over the past 4 decades. In 2012, 9 times as many women 35 years and older had their first children compared to 4 decades earlier. It's a trend Dr. Maria Corigliano says she sees with her own patients. She's one of the owners at Audubon Women's Medical Associates in Williamsville.
Now, 35, 38, it's not unusual to start your family.
Several women told us when they had their first child.
My first daughter I had 29, turning 30.
32, 33.
So why are women waiting? A report from the CDC shows women who wait are more likely to have more resources, including better incomes.
When I first got married, even though I was 25, I still felt like a kid.
Elizabeth Waddell waited almost 5 years to have her first child when she was 29 years old. She says she owns a ballet studio and was busy with work.
I wanted to get that established more and become stable in my profession.
Dr. Corigliano says she also waited to have her first child until she was 30. She was busy with her residency after years of school.
And I probably would have waited 2 more years until I thought that maybe it's time to have a baby.
Still, Dr. Corigliano warns there are some health risks for women and babies as women get older. Older moms are at a higher risk of diabetes, high blood pressure, and C-section. Babies are more likely to be born premature, and it could also take women longer to get pregnant.
After 30, it's more difficult to get pregnant. And after 35, it's even more difficult.
She says it only gets harder from there, but it is possible. Elizabeth Waddell had her 3rd child when she was 42.
I was really nervous when I got pregnant. I said, oh no, something's going to be wrong. And my doctor said, oh my gosh, women are having babies 45, even older now.
Besides careers, women say there are other benefits of waiting, like being more mature and spending more time as a couple.
Years ago, people would get married to have kids, but now people get married for love and then have kids after, so.
Dr. Corigliano says staying healthy is a key to having a baby at an older age. She also says how fertile you are at a certain age is different for every woman. You can meet with a fertility specialist to talk about your options. Live in the newsroom, Christy Kern, News 4 at 6.